Childbirth can be traumatic. Unfortunately, 4.3% of women experience poor childbirth. Your perception on how awesome your labor is actually depends on how in control you feel. One way to have a sense of control is by preparing for your journey, including the use of a birth plan. Whether you have a negative or positive experience, it will have short and long-term effects. Negative experience can make you feel traumatized and reduce your desire to have more children. To make it worse, it can even lead to postpartum depression. For a positive experience, women need to be involved in the decision-making process. To allow women to get a sense of control on their experience, a birth plan was first introduced in 1980, where women can express their expectations and needs. It has been over 40 years since the introduction of birth plans, and it still remains popular, simply because women want to avoid unnecessary interventions. Birth plan is often associated with positive outcomes and greater satisfaction. A study with 457 women showed that women with birth plan are less likely to undergo C-section. Having a birth plan is also associated with better breastfeeding initiation in the delivery room. It makes total sense that you're prone to postpartum depression if you are not satisfied with your childbirth experience. So it is not surprising that a study with 106 women showed reduced fear and postpartum depression with better childbirth experience. But it is also important to note that you still need to be flexible. Being flexible allows you to effectively communicate and discuss with your doctor. For example, you might be adamant you don't want epidural, but you might need it. So know your options and your preference, but don't be hardwired to it. Unrealistic expectations and inflexible plans can result in dissatisfaction. The way to avoid dissatisfaction is if you prepare your birth plan and then discuss with your doctor. Without any discussion with your doctor, you can have lower sense of control since you don't know what to expect. But note that some doctors might not be as receptive towards birth plans. Birth plans are also useful for your doctor to identify misconceptions and anxiety that you have. They can address these issues well in advance so that you can be convinced and comfortable with your decision. To get you started, we would like to offer you a birth preference plan on our blog site. It is completely free and will help you properly plan out your birth journey, so you can have a peace of mind and confidently welcome your little one into the world. If you find this video useful or know someone who might benefit from our birth preference plan, share this with them. If you yourself are pregnant, watch other videos on our channel to feed your brain about pregnancy. Also click the subscribe button so we can keep you up to date on the science of pregnancy.